Today, we're talking about something that hits close to home for many of us. If you've been dismissed when you describe your numbness, your tingling, your burning nerve pain, told it's just stress, even though you have Sjogren's or you strongly suspect it, that's you. You need to keep on watching. Hi, I'm Dr. Wada, quadruple board certified allergy immunology physician and someone who lives with Sjogren's disease. And for the first time ever, we have official clinical practice guidelines specifically for nerve involvement in Sjogren's disease. Today, I'll break down what they say, explain the 7 main types of nerve damage in plain English, and give you an action plan for your next doctor's visit. In my practice, I see a pattern that breaks my heart. Years of strange symptoms that don't seem to connect. Numbness in your hands and feet, tingling that appears and disappears, burning feet that keep you awake, dizziness or racing heart rates when you stand up, unexplained digestive or bladder changes. And the response often patients receive is, your labs are fine, high five, it's probably anxiety, or you're just stressed. Here's what many doctors don't realize. For a significant number of people, these nerve symptoms can show up years before the classic dry eyes and dry mouth in Sjogren's disease. And that gap between when neurologic symptoms start and when you finally get diagnosed, that's where suffering lives. And that's where medical gaslighting happens. These new guidelines were created to help close that gap and give us a shared language with our team. So what are the guidelines? A panel of top experts, neurologists, rheumatologists, Sjogren specialists, spent 3 years reviewing the science and creating a consensus document. And the result is a unified, evidence-based framework for understanding nerve involvement in Sjogren's disease. They identified 7 main categories of peripheral nervous system problems. So when we think about the nervous system, there are 2 main areas that we think about: the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which is everything outside of that. All right, so let's break them down. Number 1, mononeuropathy, damage to a single nerve, mono meaning one. Think carpal tunnel syndrome, trigeminal neuralgia, which affects the face, extremely painful. Number 2, large fiber neuropathy. These nerves control balance, vibration sense, and muscle strength. And when affected, you might trip more, feel unsteady, or notice weakness. Number 3, small fiber neuropathy. This one's common and frequently missed. Causes burning or stinging or electric shock sensations, usually in the hands or feet. Temperature sensation changes can also be a part of this. And the frustrating part is that often standard nerve tests will come back normal. And the tests that we do have aren't always 100% conclusive in diagnosing small fiber neuropathy. Number 4, demyelinating polyradiculoneuropathy. I know, that's a mouthful. It is a widespread immune-driven nerve damage causing significant weakness and sensory loss. Number 5, ganglionopathy, a more severe form where the nerve cell bodies themselves are damaged. This creates profound balance issues and spatial disorientation. You can't necessarily sense where your limbs are without looking. This is also challenging to diagnose because there aren't any specific tests that can confirm this condition. Number 6, vasculitic neuropathy, nerve damage from inflammation of the tiny blood vessels supplying your nerves. And number 7, autonomic neuropathy. This affects nerves controlling the automatic body functions, heart rate, blood pressure, digestion, bladder function, sweating. This is where POTS, dysautonomia, racing heart, and gut motility issues often come from. Now, you don't need to memorize these 7 categories. What matters is that your symptoms are now more formally recognized, named, and categorized. They're not vague, weird feelings. They're distinct types of neuropathy with recommended evaluation and management pathways. So why is this a game changer, and why does this matter for you? 1, it pushes doctors to ask better questions. These guidelines encourage physicians to look beyond dryness and actively screen for nerve and autonomic symptoms. It also creates a roadmap for collaboration. Neurologists and rheumatologists now have a shared framework. You won't just get bounced between specialist to specialist with no plan. At least that's the hope. It validates your experiences too. So when you say my feet burn at night or I get lightheaded when I stand, there's now an official evidence-based document that says, this deserves proper evaluation. So the hope is this will help decrease the times that you're said, oh, it's just your anxiety, it's just stress. So what's your action plan? How can you use this information practically? Number 1, step 1, document your symptoms in detail. When did they start? Where exactly do you feel them? What makes them better or worse? Number 2, group your symptoms by category. Are you having sensory issues, like in how you feel things, numbness, tingling, burning, electric shocks? Are you having motor issues, weakness, tripping, dropping things? Autonomic issues, dizziness, heart racing, digestive or bladder changes, sweating issues. Write these all down. Number 3, bring the guidelines to your visit. You can simply say, hey, I read the new clinical practice guidelines for peripheral nervous system involvement in Sjogren's. Given my symptoms, like burning feet and dizziness, can we talk about whether I might have neuropathy and which category it might fit? Step 4, ask what the plan is. Do I need specific nerve testing? Do my symptoms sound like small fiber, large fiber, or autonomic involvement? What would change about my treatment if we confirm that this is Sjogren's related neuropathy? You're not telling your doctor what to do. You're opening an informed and collaborative conversation. So if you're watching this and thinking, that's me, that's my body, you're not overreacting and you're not alone. These guidelines exist because thousands of patients like you kept speaking up. If this was helpful, please subscribe for more plain English breakdowns of autoimmune topics and the overlap between allergy and autoimmunity. Save this video for review before your next appointment. And for personalized care from someone who truly gets it, check out the new patient packages at the Immune Confident Institute. I'd be honored to partner with you and my team. And for daily support from people who understand this journey, join our free Success with Sjogren Sisterhood on Facebook. You don't have to be female to join. All links are in the description. And remember, advocating for yourself with better information isn't being difficult. It's how you get the care that matches what your body's been telling you all along. Until next time, take care.